Hi, welcome to Keto Life Support, where we make your keto life sustainable, fun, and low stress. I'm Kim Howerton from theketonis.com, and I'll be coming to you weekly with some of my keto besties to bring you the practical, real-world keto advice that you need. Quick disclaimer, I am not a doctor, and even if we have a doctor in the house, he or she is not your doctor, and nothing on this show should be taken as medical advice. Always check with a trusted medical professional about your personal medical concerns. Hello.
Hey guys.
Welcome. I'm Kim.
I'm Dr. Ken.
And we're here tonight doing a posted live.
Yes. We're live on my page and we're live on the Ketonist, which is your page.
Yep.
This is Kim Howerton, the Ketonist. She's visiting us from California, and we're very happy to be hosting her. She and Nisha are working on some excellent keto recipes, which I can't wait to try. And we're going to talk to you this evening about the thyroid glands.
The thyroid. So if you don't know me on Dr. Ken's page, I'm Kim Howerton, as Dr. Ken just said. And I have hypothyroidism, and I've had it for a very long time. And so it's one of the things Nisha and I have bonded about. And what I wanted to talk about tonight was let's get down to it.
Yeah.
What is, so you can either be hypo.
Right.
And what causes the thyroid to break down?
So there are a variety of thyroid pathologies or problems. And so tonight, let's focus just on low thyroid, hypothyroidism, and all the things that are related to that. There's also hyper or overactive. There's thyroid cancer. There's goiter. There's thyroid nodules. All these different things can go wrong with the thyroid glands. And we're going to focus tonight on low thyroid or hypothyroidism. And we'll talk about the symptoms.
Yeah.
And we'll talk about all the tests that you need to ask your doctor for, because many doctors are shy about ordering all the tests that you need to fully evaluate what kind of hypothyroidism you have and what kind of treatment. And then also to follow the treatment, you need to check more than just one test. And we'll get into all that.
Right.
Yeah.
That's awesome.
Yeah, let's do that.
Yeah. So I wasn't diagnosed with hypothyroidism until I was in my 30s, but the doctor that diagnosed me said that I actually have, when we went back and looked at all my symptoms, I had probably started to be hypothyroid in my teens.
Probably, yes.
What does that look like, and why does that why did it take me 20 years to get diagnosed?
So it's actually very common for the average patient with low thyroid to have low thyroid for up to a decade, 10, 15 years before they're finally diagnosed by a doc. And in part, that's because of the lab work that doctors were taught to check in med school and in residency. And I was also taught this. And if I hadn't continued to read and learn and study, I'd still be that doctor. And so we'll talk about our first test.
Okay.
The TSH.
Okay.
And we'll touch on it briefly here, and then we'll get into it a little deeper later. And so many docs, when they check your annual lab work, they'll check a TSH. And that is one way to look at the thyroid system. And I'll explain more later. But if you only check a TSH, you can miss severe Hashimoto's, thyroiditis, and you can miss hypothyroidism. And so probably when you were in your 20s, your docs, you probably were telling him low thyroid symptoms.
Right.
And he would be like, I'll check a TSH. And it was normal.
Right, probably.
And therefore, you did not have low thyroid, even though you did.
Right.
And so that's why, and it's not that it's some mystery. It is a mystery to some doctors, but it should not be a mystery. If you have low thyroid symptoms, checking a full panel can tell us, is it the thyroid or is it something else that needs to be evaluated? And so, that's why. It's probably your doctor, although well-meaning.
Right.
And intelligent and dedicated. He just checked one test instead of the full panel, and he missed it.
Yeah. So what is my hair suffered quite a bit, people. Because one of the main symptoms that I can trace back to then is that about half my hair fell out while I was a teenager.
It's very common to have a lot of hair loss. That's a little more common in women with low thyroid than it is with men with low thyroid, but it certainly can occur in men with low thyroid as well.
So from what I know about your thyroid,
yes.
is very important.
Very important. Very complex.
What does the thyroid do?
So the thyroid is really considered kind of the mother of all the glands, all the endocrine glands in the body. It's the master gland, we sometimes say, but basically the thyroid hormone that ultimately is produced, if everything's working correctly, really regulates all of the different facets of your metabolism. And so if you have an underactive thyroid, what you effectively wind up with is a very slow metabolism. And it's definitely much more complicated than that, but that's how it feels to you as a patient.
Right. You're tired.
You're tired all the time. And so tell us, I want to know specifically, I want to know your symptoms.
So what my symptoms were over the years were kind of this lethargy, this kind of chronic exhaustion, a general feeling of, like I want to do things and I can't. There was also a fogginess to my thoughts sometimes, like as if I hadn't had a cup of coffee and I needed one. And then the other part that was interesting that I didn't put all the pieces together until later. So it was a symptom, but I didn't know it was a symptom, was chronic depression.
Yes, definitely. Your mood is intimately related and connected to your thyroid function. And you can have a quite severe depression with low thyroid. And actually, back in the old days of medicine, doctors would treat depression with T3. That's actually a thing that was done in the past. If you use too much T3, you can actually cause a lot of other medical problems. And so that's probably not a great idea.
Should be regulated better than.
Right. But that just speaks to how powerful the thyroid hormones are to mental health as well.
Yeah, absolutely. And to this day, the reason that I know that was one of the symptoms is if something goes wrong with my medication that I'm currently on and I forget or stop taking my thyroid medicine for a little while, all of a sudden I am in the pit of hell yet again.
So it gets pretty severe.
It gets pretty bad. Yeah, it's a big mood stabilizer for me to have my thyroid in an appropriate zone.
Absolutely. It's a big deal. Yeah. And what about bowel function? Did you have any symptoms there?
I don't think so.
The classic symptom would be chronic constipation with low thyroid, but not everybody has that.
Right. Now, this is one of the hard parts to think about because if you guys didn't know, I am keto and since I've gone keto, I've learned a lot about my digestion. I totally forgot. I had chronic stomach issues in terms of, so yes, apparently I did have bowel issues and I've just forgotten about them, but it was, sort of one of those situations where it was just like never quite right. It wasn't just chronic constipation. It was sort of like alternating constipation, diarrhea, just like I considered myself somebody with a sensitive stomach.
Yes.
And so that is no longer true. So I don't think that was really entirely right.
May have been partly diet related, but definitely partly thyroid related as well.
Right.
Yeah. What about, and you already talked about your hair. Tell us more about that.
Well, it's very shiny, but, I have extremely thin and fine and just not a lot of hair. Like I have the like baby ponytail, when you put your hair in a ponytail and you're like, I can use one of those infant ponytail holders. And that was not true when I was a little kid. When I was a little kid, I had thick, like a lot of hair. And as I entered into sort of puberty, about half of it fell out. And then, I just thought that, you're a teenager. You don't really know what's happening. And, but one of the things that later, as my thyroid got progressively worse, as I'd gone to like 2 or 3 decades of hypothyroidism, is my eyebrows started to fall out and my eyelashes started. Like my body was like, would you please pay attention at this point?
And that's a very classic sign also, is usually the outer third of the eyebrow will just get thinner and thinner. And I've seen women who I could see across the room in a restaurant or in an airport. It's like, oh, you have low thyroid. I can tell from across the room just by looking at their eyebrows. And then also the thinness of their hair and the dryness of their skin. Any skin issues?
I've always had chronically dry skin. And also I've had, there's so many symptoms and this is the problem, people. And this is why women feel like they might be crazy is because you're like, oh, these are just normal. Right. Like dry skin, get a moisturizer. Thin hair, well, that's just bad luck. Upset stomach, well, everyone has IBS. Right. But it's like you add these things up and you go into your doctor and they're like, nope, your TSH is normal. They
check one test and part of the reason women think it's all in their head is because when the doctor checks the TSH and it's normal, he says, it's all in your head. Here's some Prozac.
Right.
Or here's some Zoloft or here's some Lexapro or Effexor or now Abilify. And so, no, it's not all in your head. If you have those classic hypothyroid symptoms, it's definitely a hormonal thing going on. It may not be thyroid. It may be adrenal. It may be your gender hormones, but you've got a hormone issue. If you have more than a few on that list that we've been talking about, there's a hormone issue somewhere. It just has to be found.
Yeah. So hypothyroidism is caused by a couple of different factors potentially. Yep. Am I right in that Hashimoto's is the predominant cause of hypothyroidism?
It's one of the very most common. Yeah. Okay. And Hashimoto's is actually a thyroiditis or an inflammation. It's where your immune system is attacking part of your thyroid system. And initially you can actually have overactive thyroid.
I have heard that.
You can actually have a high thyroid or hyperactive or hyperthyroidism. But then after a while, when your immune system has eaten up enough of your thyroid system, then you start to have the low thyroid symptoms.
Wow. Okay. And so are there other things we can point to that we know might cause hypothyroidism?
Yeah, and so you can just have hypothyroidism, which we would call idiopathic. And idiopathic, anytime you hear that word, that means the doctor has no damn idea. That's what that means in Latin. I have no damn idea why you have this, okay? The human body is more complex than scientists and doctors let on. We have only scratched the surface of understanding. And now if any doctor acts like, oh no, we've got it all figured out, we know all the pathways, that's called being sophomoric, which means wisely foolish, just enough to be dangerous. There are many, many things about the pathways in the human body that we're still discovering on a daily basis. And why do you have hypothyroidism? We may never know, or we may know in 20 years when we develop a new test to check for something we didn't even know to check for today. But many times you can have idiopathic hypothyroidism and we have no idea. You can have autoimmune thyroiditis, which can ultimately lead to low thyroid. You can have, if you have certain types of radiation injuries can lead to.
That's why they cover your neck when you get X-ray.
Yeah. Anytime you have an X-ray or a CAT scan of any part of your body that's anywhere close to your thyroid, you need to have a little lead shield over your thyroid because enough radiation can really wreak havoc with your thyroid system.
Right. And when you're at the dentist and they do the dental X-rays, sometimes they're not very careful with your neck. So make sure that is up.
And truth be known, there's not a lot of radiation if you get a dental X-ray or a chest X-ray but now if you get a skull X-ray or a CAT scan of your head, that's a lot of radiation. And so anytime there's radiation, your dentist doesn't know how many CAT scans of your head you've had or CAT scans of your chest. And so even though it's a minuscule amount of radiation that he's going to give you, you still need to have a lead shield over your thyroid. That's a big deal.
Right. I guess any little bit helps not to get exposed to it.
Any little bit helps because what if you were in a car wreck a month from now and you have to have 3 CTs of the head and the chest, and that's a ton of radiation. That little bit you got at the dentist may be the straw that makes the camel have to go to the neurosurgeon.
Got it. Okay.
Right.
So some people wonder if you can fix a thyroid problem.
Well, and that's a great question. I've not seen that happen, but I have seen people's thyroid function improve.
Okay.
With the right diet and the right lifestyle. I have seen the numbers get better. I've seen the thyroid antibodies go down. I've seen the thyroid function improve to the point where I've had to decrease people's medications, but I have not seen anybody completely correct or cure their low thyroid with diet or lifestyle alone.
Okay. Unless it's like a specific thing, like they're not eating salt and then they didn't get enough iodine. Right. But those are very specific.
Exactly. Yeah. If you have no iodine, then you cannot have any thyroid hormone, because every molecule of thyroid hormone has either 3 or 4 iodine atoms attached. And so if you don't have any iodine, you can't have thyroid hormones. And for a lot of people starting to take an iodine supplement, and you really can't get iodine from salt. Even iodized salt, either the iodine is sublimated or it's not bioavailable. You really, unless you know you live in an area of the country near the ocean where there's lots of iodine in the seafood and lots of iodine in the soil.
You eat a lot of seafood and nori.
You probably need an iodine supplement, because there's just not enough iodine in the soil most places in the country and in the world.
All right. So most people will potentially have to supplement regardless of the cause. So somebody I saw had asked, what's the difference between Hashimoto's and hypothyroidism? And am I right that Hashimoto's is a cause of hypothyroidism?
Yeah, it's a thyroiditis, which can ultimately lead to the destruction of enough of your thyroid function that you will become hypothyroid.
Yeah.
Exactly.
Okay. Does it matter? I guess it matters because we want to know, but does it matter in treating hypothyroidism that you know what the source is? Like, do you treat Hashimoto caused a hypothyroidism different than you treat idiopathic?
Not much. But the reason I like to know if you have Hashimoto's is because Hashimoto's thyroiditis is an autoimmune thyroiditis, right?
Okay.
And anytime you have one autoimmune condition, you're at increased risk for having a second and a third.
So you just want to know if somebody has.
I need to know if your immune system is attacking part of your body. As your doctor, I need to know that so I can be on the lookout for other autoimmune attacks. And also so that I can counsel you to say, hey, you need to stop eating crap and living like crap and drinking crap and smoking crap, because you're destroying and you're really kind of pissing off your immune system, and it's starting to attack parts of you that it shouldn't attack.
Right. So you need to know, if you find out that you have some type of autoimmune condition, you have to be doubly on top of your health game.
Exactly. Okay. And you have to take your diet and your lifestyle deadly serious.
Right. Because that little weekend trip to Vegas with the buffet might cause your entire system to crash.
That's right.
That'd be sad.
Be the final little bit that needed for the second autoimmune condition. And that could be lupus, that could be Sjogren's, that could be multiple sclerosis. I mean, terrible, terrible things are autoimmune in nature. And so if you have Hashimoto's, I need to know that so that I can be on the lookout for other things and to counsel you, a lot about how to fix your diet and fix your lifestyle.
Okay. So we talked about the fact that a lot of doctors only really know to test TSH, which is thyroid stimulating hormone.
Right. And it's actually a hormone that's secreted by the anterior part of your pituitary gland, which is deep in your brain. And so TSH is not even a thyroid hormone. It's a brain hormone that talks to your thyroid and tells your thyroid, hey, dummy, make some thyroid hormone. Okay. And so there are multiple thyroid hormones. There's T0, T1, T2, T3, and T4 that we know of. There may even be more that we don't know about yet. But the two that we care the most about are T3 and T4. And so those are actually the thyroid hormones. The TSH is a brain hormone.
Okay. So it's essentially that your body's intercom system has told you might have a thyroid problem if your TSH is off.
And so what can happen is that the TSH can remain normal even though your thyroid is struggling for years to make enough thyroid hormone. You can have severe Hashimoto's thyroiditis and your TSH be completely normal. You can have hypothyroidism and your TSH be completely normal. And so when you check a TSH, it really, all it tells you is that you do not, if it's normal, then you don't have severe prolonged hypothyroidism and you don't have severe hyperthyroidism. But as far as the gray zone, the mild and moderate, it really doesn't give you any indication at all. And then also when you're following someone who's been started on thyroid replacement therapy, just checking a TSH again gives you only the roughest of pictures. Okay. It does not in any way give you enough detail to manage their thyroid appropriately.
Right. And so it's really important to catch this because I don't want to be like all vain and everything, people, but I am 42 years old and going 2 decades untreated with my thyroid. As you get older as a woman, some of your hair falls out anyway, right? It gets a little thinner as you go into premenopause and menopause. If you don't deal with some of the symptoms of your hypothyroidism soon, things happen like hair follicles die.
Right. Permanently.
Mm-hmm. And so I'm not going back to a thick, full head of hair unless I buy it. Because living with that reduced hair growth cycle means that my whole not my whole biology, but my whole hair landscape shifted. And that's just one example.
Well, it's just like a garden. If you got a beautiful, lush garden and you stop watering it.
Yeah.
After a certain point, plants start to die. Individual plants die to death, and they're dead, right? And then a month from then, you can start watering it again and doing everything perfectly, but you're still going to have a patchy garden because some of those plants are just dead.
They're just not coming back.
Right, exactly.
So you want to deal with these things sooner rather than later.
Yeah. And how sad it is for a woman to go through an entire decade of her life, being miserable, being almost depressed, if not depressed, gaining weight and not really understanding why am I gaining this weight, being chronically constipated, having skin and hair issues and all this is unnecessary if her doctor will just do his job. And now I phrase that as a female patient, but men can suffer from this just as easily as women. Yeah. It's a more common condition in women. It's more common in women.
Why do we think that is?
It's the hormones. It's
we're just more complicated.
Yeah, you're just more complicated. That's all it is. But actually so it's idiopathic. Okay? We don't know why that is actually. We have theories, but we have no idea.
Well, I would guess if you have more complicated hormones, there's just more places for them to break down.
Exactly right. I think that's entirely true because a lot of those symptoms are general symptoms. Right. And it's very common for a doctor to hate to ask you 3 questions. And the 3 questions are, how's your energy level? That's a very important question.
It really is.
If your energy level's not good, that's not good. You should do something about that. No. But most doctors don't have any bullets in their gun to address that. The answer to that, if you say, my energy sucks,
I'll be like,
what's he going to do? Because he'll check the TSH. It's normal. So then he'll give you some Wellbutrin. Right. And that's not a lot of fun as a doctor. So the doctors who think the old way just don't ask that question. The next is, how are things in the bedroom? Because that's another thing that can be affected by low hormones, including hypothyroidism, is things aren't that great there. And if a doc doesn't know about the hormones in detail and how to really thoroughly evaluate the thyroid gland and other glands, he don't want to ask that question because there's nothing he can do about the answer.
Yeah, absolutely.
Right? And then the third one is, how are you sleeping? Because other than a habit-forming sleeping pill, what's the average doctor going to do if you say, dude, I'm sleeping for crap. I'm tired all day. I don't sleep good at night. That's a hormone issue. Right. But if a doc's not well-versed on hormone optimization, he's not going to ask you that question because he has no bullets in his gun except for a habit-forming Ambien or Lunesta. And more docs are not wanting to use that sort of medicine, which is good. Because you should fix the underlying problem, not just cover it up with a habit-forming Band-Aid. Right.
Because you're exhausted all day, right? Yeah. But you don't sleep well at night.
Exactly. And obviously, think about that. If I took you out on my farm and worked you like a dog all day, you'd sleep like a baby.
Yeah.
Unless there's something wrong with your hormones.
Right.
Then you still might not sleep good even though you're exhausted. Right. And that should be a huge red flag. Something's not right. If my energy, I slept last night, I've eaten, and my energy sucks every day, that's a problem. That needs to be evaluated thoroughly. If things aren't right in the bedroom, that's not okay. That needs to be evaluated thoroughly. If your mood, if you're just chronically down, that's not the normal human condition. And I very much agree with Dr. Kelly Brogan in this, that an antidepressant, take some Lexapro. That is not the answer. Before your doctor gives you an antidepressant, he should have checked reams of lab work to evaluate your thyroid, your adrenals, your insulin function, your gender hormones. I mean, there should be many, many blood tests done before he says, well, I can't find anything. Let's try some Lexapro. If that's his knee jerk, that's a bad sign.
Yeah. I was on a number of antidepressants through my teen and college years none of which worked because none of them were thyroid medication.
Right. So exactly.
So that was like, they're not helping.
Yeah, exactly. Yeah. Your car won't start, so let's put a ribbon on the antenna. It didn't. It still won't start.
Although one of them did make me gain 40 pounds in a month. That was fun.
That was
really, awesome.
Yeah. Which one do you remember?
I don't, but it was one that like literally, I think it might have been, but it was one of those where like my doctor was like, "You're taking what?" And I was like, "Dude, you prescribed it to me."
That's so reassuring.
So it was sort of a very He's like, "Oh, I must have written the wrong one down." So not only was it the wrong medication,
and he said that out loud.
He said that out loud. Not only was it the wrong medication for the treatment for the symptoms that I didn't have, but then it was also the wrong one. Anyway, like how wrong?
It's like a double oops.
Be? Yeah.
Oopsie.
So okay, so we've evaluated TSH not going to cover it.
Right.
For most people.
Right. And so if you have these low thyroid symptoms.
Yeah.
There's a panel of tests that you need to ask your doctor for, and your doctor hopefully is up to speed on this, and he'll just order this as his knee jerk to these symptoms, because that should be his knee jerk response. Oh, it sounds like you've got low thyroid. Let me check a thyroid panel. And there's a list of tests that you should ask for. So if you have a pen and a piece of paper, get ready, because I'm going to give you these tests. So you'll hear some authorities on the web say that the TSH is a useless test. That's absolutely not true at all. The TSH is a very useful test if checked in conjunction with the full panel. So I always check a TSH, and that's the first one on the list. Then you'll need to have a free T4 or an FT4. And that's actually the circulating thyroid hormone. It's not the active one, but it's actually the majority of thyroid hormone in your bloodstream at any given moment is T4. And you want to check for free T4. You don't want to check for total T4 because you're also then looking at the T4 that's bound to proteins in the blood.
So it'll give you a false answer.
It's just not a helpful answer.
Okay.
Right. It's not a helpful answer. So, free T4. Then the next one is free T3 or FT3. And that's actually the active thyroid hormone. That's the one that actually works in your body. Okay. And so then the next is a reverse T3 or an RT3. And, we'll come back over these and talk about why each one's important after I list them off. So the next test is a Tpo Antibody or a Tpo AB. Got that? And that's one of the antibodies that will show if you have an autoimmune condition that's attacking part of your thyroid system. The next is a TG antibody or a TGAB. And that's another way that your immune system can inappropriately attack your thyroid system. And then now I'll tell you, there's probably 80 tests in the LabCorp or the Quest lab manual for thyroid. And so there's all these other tests that you can test, but that group of tests is going to give you a very thorough look at the thyroid function and if there is any hypothyroidism or low thyroid. And then also your doctor can use the same panel to manage your hypothyroidism once it's been diagnosed.
Got it. So one of the things that often comes up, and I saw a couple people saying this on the thread, was their doctor will test the TSH and then they'll test T4. Mm-hmm. It's one step better, but why will that not be enough? Well,
and so the reason he does it in a stepwise fashion, that's how we're taught. You check a TSH as a screening test.
Okay.
And then if it is inappropriate, if it's high or low, then you'll check, usually it's a T4. And that'd be a total T4, which again is not a very helpful test, but it doesn't give you any indication of the actual active thyroid hormone in your bloodstream, which is T3. It doesn't give you any indication. And so that the TSH and the T4 or a TSH and a free T4, that is the standard two. But many docs will start with just a TSH. And then if it's abnormal, they'll check a T4 or a free T4. And then that's it. That's the extent of the depth of how they're going to test. And even if you go to an endocrinologist who they're supposed to be thyroid specialists.
Sadly, they're so not.
Well,
some of them are.
I'll tell you, I have one in Nashville who's very good. He's on board. He understands what we've been talking about here this evening. But the rest of them, every time one of my patients goes to see them for something else, they'll take them off their good thyroid medicine and say, don't take that. That's not good. Take this other instead. Then the patient comes back to me in a month or two and says, I went to the endocrinologist and they took me off the good thyroid medicine and I feel like crap. Can you put me back on it? And that happened to the good doctor, who's now a good doctor because you guys woke him up, because you kept going back saying, no, stop that. I feel like crap when you put me on that. I want this other one.
Right.
And he heard that so many times. He finally told me, he's like, dude, what the heck? And so I'm like, just leave them alone. They love it because it makes them feel better, because it's good. It works. It does the full job.
If you feel good, it is an indication that something is working.
Exactly. Unless you're smoking crack, then you're feeling good because that's an illicit drug.
Right.
But if it's a good FDA-approved medicine and you feel good taking it and it's not habit forming and it doesn't harm you, why would you not leave the patient on that medication? And so he got yelled at so many times, he now just leaves them on the good stuff.
Eventually a good man will change, or a good woman, a good person,
a good doctor
will change their mind when enough evidence is presented to them.
Exactly, and that's what happened to him. Enough evidence was presented. Exactly.
So traditionally, when people, we've got this. So traditionally, people were testing not the wrong things, but too small a range.
Yeah, just not enough.
So you might get these, but now you're like, okay, I'm going to get this full panel done so that I really know. And then your doctor says, okay, you do have some thyroid dysregulation. I see it now. I'm going to give you some synthetic thyroid hormone. Right. What's the problem with that?
And so by far the most common treatment for hypothyroidism in the United States these days is either Synthroid, and its generic name is levothyroxine. Now, Synthroid is synthetic. It actually has syn in the name. Synthroid.
Clear.
Synthetic. It is fake. It is fake T4. You cannot get a patent on a real biological molecule.
Okay.
And so you can't get a patent on real T4.
Right.
Therefore, Big Pharma's not interested in that. And so they take a T4 molecule and they add, a hydroxyl or a methyl group. That's a unique molecule. And they can get a patent on that and make $1 billion, right? But at the same time, it's also not the same molecule anymore, is it? And so it fits so into the receptor. It converts to T3 pretty well, but then it's also not real T3, is it? Right. Still got that extra little thing attached.
It doesn't have any T3, right?
When it's converted, it's still got that extra little thing tacked on.
Okay.
And so it would be like if I took your phone and I put something there and you tried to put it in your holder, it wouldn't fit. You're like, well, why won't it fit in here? Or it would sort of fit, but not really.
Right. It's like that game with the
exactly,
little kids
and that's what happens with fake T4 with Synthroid. It does fit sort of in the receptor, but it doesn't fit perfectly, and therefore you don't get complete symptom relief. And then also, it doesn't convert really well from fake T4 to real T3, which is the active molecule that you need anyway. And therefore, a lot of people take synthetic levothyroxine or Synthroid. They don't feel any better, or they feel a little better, but not a lot better.
Well, and so one of the so our bodies produce T4 if our bodies work.
Right.
And then, but for your body to use that,
there's an enzyme
right?
that converts you from T4 to T3. Right? And now here's where the reverse T3 comes in, because some people's pathway doesn't work exactly right. And so you can convert T4 into T3, but sometimes it'll also convert, and actually it does every day, but if you convert too much into reverse T3, it's not active. And they're isomers, they're enantiomers. And so my hands look very similar, right? But they're actually not. This won't fit in that glove.
The thumbs are on the wrong side.
That's right. You see what I'm saying? And so this is reverse T3 and this is real T3. You want this. This is what's active in the body, but this won't fit in the receptor. It looks similar, but it's not. And so if you have a conversion problem and and I'm only giving you fake T4 and you can't even convert real T4 to T3, then how are you going to convert fake T4 to T3? And so you're going to wind up with a lot of reverse T3, which is not biologically active in your body, doesn't help your symptoms any.
It's like the conveyor belt in the factory. There's like a clog somewhere. And so they're like, well, we just keep sending more. We don't know why.
And so they'll keep upping your dose of fake T4. And you're like, nope, I still don't feel any better. Nope, still don't feel any better. That's probably what's going on, is you have a conversion problem. And when I check your reverse T3, it's going to be really high.
Yeah.
And then your free T3 will be really low. You've got a conversion problem. And so when I give you a real thyroid replacement hormone like Armour Thyroid or WP or Nature, it has real T3 and real T4. And so even if you have a conversion problem, you're still able to get T3. Right?
Yeah.
Does that make sense?
Yeah. Because you're supplying it directly.
Exactly. That's exactly right. And your body's still able to convert some of the real T4 to T3, but you've got T3 to start with. And so it kind of takes the conversion problem out of the equation.
That's amazing. That's very good information. Now, there is one thing we kind of jumped over, which I was just thinking about. So just like doctors will test TSH often and say, oh, it looks normal.
Mm-hmm.
They will also potentially say, okay, fine. I will run these other panels that you were telling me just to get you out of my office. Mm-hmm. I'm inventing a scenario, but this is probably truth in many situations. And then they're like, oh, these numbers are fine because they're within reference ranges.
Right.
What's the problem there?
Okay. So just a few years back, a TSH under 10 was considered normal.
A TSH under 10.
Under 10.
Okay.
For one reference lab for not many years back, if your TSH was 9.5, that was considered normal.
Yeah.
And now if it's under 5, it's considered normal. But
that's not lower.
That's a huge deal, right? And so all those women, all those years suffering, can you just feel them suffering?
Yeah, absolutely.
With a 7.5, and they're like, no, it's normal, it's fine. Yeah, run along. Here's some Prozac.
But now they're like, oh.
Yeah, now, that's too high. And so actually, one reference lab considers anything above 3.5 to be high now. And so it keeps coming down as we learn more and more about the thyroid.
Yeah.
I personally, I start to worry about hypothyroidism symptoms in a woman if it's under really 2.5. That's when I really seriously start to consider, even if that, that's well within normal range.
Right.
But still, if you've got the classic list of symptoms and you've got a 3.3, you probably have hypothyroidism and you probably need some thyroid replacement.
So, and on all of these tests, your doctor may have a reference range, but if you still don't feel well, even though you're in reference range, it's not necessarily you that's the problem or the way you feel. I mean, the way you feel is the problem, but the way that you're not wrong.
Right.
It might simply be that your doctor is using a set of reference ranges that are either out of date or not quite sensitive enough.
Exactly right. Exactly. Or that they're misinterpreting. And so that's why it's very important not to be shy about seeking a second opinion, because the answer, it's all in your head, whether it comes from your husband or your wife or your doctor or your nurse practitioner or your PA or your nurse midwife, is never the right answer. That's never, ever the right answer, ever. Okay? And so don't accept that answer any longer. If you've been told that, you need a second opinion. Even if you heard it from your spouse, you need a second opinion, because it's never all in your head. There's something going on. You're not crazy. Okay? Maybe you are crazy, but you're still not crazy about this. That's a whole nother show.
Yeah.
But you're not crazy about that set of symptoms, because crazy doesn't look like that.
Right.
Crazy doesn't look overweight and depressed and my hair's falling out. Crazy doesn't make your eyebrows fall out. Crazy doesn't make you chronically constipated. Crazy doesn't make you want to sleep all day and get up out of bed and go straight to the couch. That's not crazy. So it's not all in your head. You're not crazy. You've got to find somebody who will not only check the full panel, but interpret the full panel appropriately.
Okay.
Yeah.
Yeah, absolutely.
And then treat you appropriately if you have low thyroid.
Right. And I talk about this all the time, is doctors are good people. Doctors became doctors because they like to help people. But doctors are human and they've been taught things and they get used to a certain set of circumstances and rules, and just humans like to be right. They don't like to be wrong. And all of those things added together might mean your doctor is resistant to some of these ideas.
He may be a little arrogant, or she may be a little lazy, or vice versa on both of those. And so arrogance and laziness can add up to you being severely ill and not being properly cared for.
Right. And so either your doctor will see the light because you will go to them and you will have these discussions and they will say, well, that is a reasonable discussion, let's talk about it. Mm-hmm. In which case they're probably willing and open. But if your doctor isn't willing and open to treat you like a person with legitimate concerns, right, you have to find a new one.
Yes. And as Carl Franklin, our good friend, says, yes, if you can't change your doctor, then change your doctor.
Absolutely.
I love that.
That's a good one.
I love that.
It is.
Yeah, it's awesome.
One thing that came up in the questions was their doctor won't put them on natural thyroid.
Yeah.
Because it's unregulated.
Yeah. Oh, let's talk about that. Okay. So Synthroid is now there's a generic levothyroxine, but when Synthroid first came out, it was the first of its kind on the market, and they took over the market. I can remember as a resident training, we had Synthroid samples, and in our entire sample closet was full of Synthroid samples. It was everywhere. They sponsored every dinner. They would give us free textbooks. You could do that back then. You can't do that anymore. And so they also put out there that Armour, which was the main one back then, was very inconsistent and unreliable. And back in the 80s, I think that at one point it was a little inconsistent. Back in the 80s. But for at least...
It is no longer the 80s.
Right.
Although the fashions...
You may still have the 80s hair, but it is no longer the 80s, okay? Right. For at least the last 20 years, Armour, WP, and Nature have been entirely consistent. They send out samples to reference labs constantly to prove this, okay? Because Synthroid really did a number on them. They played some dirty pool, and they captured all the doctors, and they captured a very large market share by doing that, okay? And so a lot of doctors, and if a doctor says, oh, Armour's very inconsistent, your doctor's at least 20 years behind in the reading, because that hasn't been that way for 20 or 25 years. Armour, WP, Nature, IRFA, they are all entirely consistent. I've never had a consistency problem ever. And indeed, they send out to a reference lab, an independent lab, and have their samples checked regularly to prove that they are consistent.
Awesome. And somebody asked about prescription, and yes, doctors prescribe Nature and Armour and all those. I have a prescription
all of those,
for one of them.
All of them are FDA approved.
Well, how about that, people?
They're all FDA approved, just like Synthroid and just like levothyroxine. And so if the doctor says, oh, they're not even blah, 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 no, they're FDA approved and they're entirely consistent and they're very safe and they actually work better than Synthroid or levothyroxine.
So your doctor will hopefully be open to hearing that they might want to check into the references that they are wrong about on their thing.
Right.
Are there people that do better on synthetic thyroid than?
I have about 5 or 7% of my patients who feel like they do better, and I'm happy to prescribe them levothyroxine in that case. And I have a very few, maybe 1% of hypothyroid patients who think they do better on the name brand Synthroid, okay? And so when Synthroid, the really great marketing strategy. What they did is when levothyroxine went generic, they started this rumor in the doctor community that the generic was not nearly as good as the name brand. Right. And so a lot of doctors just bought that crap. I was like, what is wrong with doctors? Yeah. Right? Because it's federal law. It has to be plus or minus 5%. Right. There's no ifs, ands, or buts. Right. They're both made in the same factory in Puerto Rico. Right. Okay? Literally, they're made in the same building. And so to act like, oh, the generic's not as good, but I have a few patients who swear that they do better on the name brand Synthroid, so I'm happy to prescribe it for them because I want my patients to feel good. Right.
Some people are asking about insurance covering Armour, and it's going to vary from state to state. And look, but my Armour is covered by my insurance company, and I have a mainstream insurance. Yeah. I will say that 1 month there was some confusion with my insurance, and they didn't cover it, and then they paid me back. But that month, I just paid an extra, it was like $30 more. Yeah. And so even that was me paying out of pocket. I think I paid a total of like $50 for it. As worth it. I know we don't all have $50 extra all the time, but it made a huge difference in my health. And it wasn't $200 or $300.
In my experience in Tennessee, WP and Nature are better covered. It's usually a lower copay than Armour. Okay. And of course, Synthroid, generic Synthroid is going to be almost free. Because that's what they want you to take because it's the cheapest for them. But, Nature Thyroid and WP Thyroid are usually covered a little better on average and they work just as good as Armour. And so if your doctor does write you Armour and it's very expensive and insurance doesn't cover it, have him convert you over to WP, or nature. Oh, and let me tell you one other thing. There's a conversion chart. And so if let's say you're on Synthroid 100 micrograms a day, right? Okay. And you finally talk your doctor into letting you try Armour. It's a very common practice because your doctor's uncomfortable with Armour. He's not used to prescribing it. And so there's a conversion chart online, and you guys can look this up so that you make sure and get converted from the right dose of Synthroid to the right dose of nature or Armour. And so the proper conversion would be to 65 milligrams of nature or 60 milligrams of Armour. But a lot of docs will say, I'm going to put you on 30 of Armour.
And then they'll say, this Armour is not working.
And then you're going to be like, I don't feel as good. Well, that's because he gave you half the dose that you should have, right?
Right.
And he's not trying to trick you. He's just uncomfortable with Armour because he's not used to prescribing it. Right. And it's common doctor practice when you're prescribing a new medicine to start with a low dose and then slowly go up. Right. And that's good practice, except for thyroid replacement. And you need what you need. Right. And so you guys can look this up before you go see your doctor. And if you're on 100 of levothyroxine, you need to be on 60 of Armour, if not a little more, or 65 milligrams of nature or WP, if not a little more. So don't let your doctor put you on 15 or 30 or 48.75.
You'd be sad.
It's not enough. Right. You need more. And so you can help your doctor by pulling out that little chart and say, now, according to this chart, doctor.
Is that on the web?
It is. It's on the web, and you can print that out, and you can cut it out, and you can take it with you like a coupon, and you can hand it to him and say, look, actually, I think you're supposed to convert me to 60 milligrams or 65 milligrams instead of 30 or 15. And he'll go, okay, let me think about this. And then he'll give you the right dose. Sometimes you have to change your doctor.
Right.
Yeah.
So, a couple of people have mentioned, it is true. I think that WP Thyroid, the brand, somehow the company is having some shortages.
Well, nature is as well right now. And it's because there's overwhelming demand.
Yeah. Everyone wants to switch.
Everybody wants to switch. And so they're covered up right now. And I know that nature is trying to build another factory so that they can increase their production. But if you have to take Armour or nature or WP, and if you have to switch between the three, they're 99% the same. Okay. They all three contain real T3 and real T4, which is infinitely better than fake T4. Right. And so even if they have to switch you around from refill to refill, it's still better than taking Synthroid.
Also, don't let your prescription run out before you refill it because you don't want to be in that panic. Okay. Was there anything else that comes up on this topic a lot? Did we miss a question?
Let me tell them about the website.
Oh, please.
And now, if you would like to become an expert on hypothyroidism, there's a website, and you can Google this phrase, Stop the Thyroid Madness. And if you go to that website, it's Janie Bothorpe, something like that. She actually has a book called Stop the Thyroid Madness, but I love the website.
Okay.
Go to the website, and after you've read on that website for an hour or two, you'll be smarter than the average doctor when it comes to managing hypothyroidism. And also the complete panel, if you didn't write them all down, the complete panel of thyroid labs are on that website. Okay, Stop the Thyroid Madness.
I have a couple of more quick ones, which is, some people say, what would you see? So say you're on a thyroid medicine. What would be a symptom you're on too high a dose?
So the way you'll know you're on too high of a dose is you'll have this nervous trembly. And women make this universal sign, like, I don't know, I just feel antsy.
Is it sort of like anxious?
Yeah, it's like almost like a quivery heart because you can have a fast heart rate. And so if your heart rate, when you're resting and calm, if it's above 95 or 100, you may be on a little too much thyroid hormone. And being on a little bit too much for a week or two is not dangerous at all.
Okay.
Now, you definitely don't want to be on too high of a dose for months and months and months and months. That can lead to heart issues and other things.
Charlene said she felt like she was having a heart attack.
You can absolutely feel like, and if you're on a way too high of a dose, your heart can be pounding out of your chest, beating really fast. You can literally have a tremor. You can just be anxious and sweaty and hot, have trouble sleeping just because you're just like uncomfortable. Like I don't know, something ain't right. SAR, something ain't right.
Okay.
Actually, in medicine, the S stands for something else, but that's we're like, SAR right there. Right? Okay. But that's how you know if you're taking too much. Now, when you go from a certain dose to a little bit higher dose, you may have mild symptoms like that for 2 or 3 days.
Okay.
Until your body gets used to the new higher dose. So what I tell people, men and women, is that when you go up to a higher dose, give it 3 days. And then if you're still having that, it's probably too high of a dose. But if that goes away within 3 or 4 days, then that's probably the dose you need to be on. And then obviously your doctor, if he's doing a good job, is going to recheck your levels every 3 or 6 months, depending on your particular case.
Okay. Great.
Yeah.
And so one of the pieces of advice I've heard quite often, and I think it's a good one, and it goes back to that reference range versus optimal range, is even if you're you're taking a thyroid medicine, you feel a little better.
Yeah.
And you're like, well, your doctor is now saying, oh, your labs are now in good range.
Right.
But you're still not quite there.
Right.
You still are like, I'm still a little run down and I still feel a little bit. You might potentially talk to them about that, right?
Absolutely. And so there's a range of normal, right? And so let's say this is the low end and this is the high end. So let's call this the Yugo or the Cavalier end of normal.
Okay.
And this is the Ferrari end of normal, right? And so if your lab falls right here, right by the Cavalier, but it's normal,
right?
A lot of docs will say, no, you're normal. I'm not going to adjust your dose.
Not going to touch it.
But why wouldn't you want to be closer to the Ferrari end of normal? And so there's no reason why, doc, if you're here and you're like, I'm still having symptoms, why wouldn't he increase your dose to get you closer to here? Now, you definitely don't want to be high. That can be dangerous.
Right.
But why not be in the upper limit of normal? That is a reasonable request to make of your doctor.
Right.
And you can just ask him, hey, what if I had come today and you checked my labs and it was right here? Would you have changed anything? And he'll say, well, no. And say, okay, then why not put me there if you would have considered that normal anyway?
Right.
And he'll be like, good point, patient, good point.
Right.
Well played.
Right. And a couple of people have asked a couple of things, which is, will keto, and we talked about this briefly, but will keto fix my thyroid, or once I'm on thyroid medicine, am I doomed to a life of thyroid medicine?
Well, you're not doomed to a life of thyroid replacement. You're blessed to a life of thyroid replacement, because trust me, you want to have your thyroid within optimal range. I have seen many people improve their autoimmune attack on their thyroid with keto. I have seen people have improved thyroid function on keto, but I have not seen anyone cure their Hashimoto's or their hypothyroidism with keto or any other diet for that matter. But I have seen it improve with a good low carbohydrate, high healthy fat diet.
Right. And I will say, I hate taking pills and I hate taking medicine. The only medicine I don't mind taking is my thyroid medicine.
Yeah. And I don't even consider it a medicine.
Yeah.
It is a hormone replacement.
Yeah.
That you're not making.
Right.
That you absolutely need. And so that would be like saying, well, I can't breathe and I give you oxygen. Well,
right.
Oxygen is not a medicine.
Right.
You need it or you'll die.
I do not resent my thyroid medicine
is my Topo Chico, is that medicine? I've got to have water or I'll die.
Right.
I don't like drinking water. I'll just stop. Well, that's dumb. No, that's not a medicine. You need that.
Right.
Thyroid hormone is not a medicine. It's not a pharmacy pill. It is a hormone replacement that you absolutely must have if you want to live your best life.
Right. But I will say that since I went keto, optimal, the bar of optimal has shifted.
Yes.
So some of the symptoms of what I thought might be my thyroid, some of that fogginess, that not being super clear, some of the tiredness persisted even after I was being treated, but went away completely once I went keto.
Yep. Yeah, I've seen it a lot. It happens very often. Yeah.
And so you can optimize your life exponentially, but I still take a good deal of thyroid medicine.
You can move any of your hormones in the right direction by improving your diet and your lifestyle. You may not move them far enough to correct them, but you're going to move them in the right direction.
Right.
Yeah.
Yeah. Do you have, just in wrapping up, I guess, do you have an idea about why so many people, why is there it feels like an epidemic?
Absolutely there is. And it's just like the epidemic of low thyroid in of low testosterone in men. There's an epidemic of low adrenal function. All these hormones, something in our environment, whether it's the food, whether it's the plastic that we live in and wear, whether it's the ozone, who knows? It's idiopathic. We don't know, but what we do know is that there is an epidemic of all those things, which means that there's way more of it than there should be.
Yeah.
Right? A young man who's 30, his testosterone should be 800 or 900. 100 years ago, it would have been. And now I see 30-year-olds every day with the testosterone of 300.
Yeah.
And it's like, why? I don't know why, but all I know is that's not normal and that needs to be optimized. And giving him testosterone is not a medicine. That's a hormone replacement that he absolutely needs to function as a healthy young man. Same goes for the thyroid. I don't know why there's an epidemic of hypothyroidism, but I do know there is one, and I do know it has to be addressed for each individual patient in an individual customized fashion, or that patient is just going to suffer unnecessarily.
Yeah. Yeah. And thank you so much for this conversation. Yeah. I think it's super important. One of the things that came up was how do we even know what the optimal ranges might be? Is that something that Stop the Thyroid Madness can help them with?
And she talks about that and talks about the different TSH levels and how it's changed over the years. And so that's a great resource. And then there's hundreds and hundreds of women and men who are on there. And then there's also a list of doctors on there who think like I do about thyroid. And so that's a great resource if you're looking for a doctor near you. If you can't drive to Tennessee and see me, then you can hopefully find a doctor on Janie's list of doctors or providers, and then you can find somebody to go to who will appropriately manage your thyroid health.
Fabulous. All right. Is there anything?
No, I think that's it. That's pretty good, right?
All right.
Yeah. All right, guys. Thank you so much.
Bye, guys.
For joining us. We'll see you next time.
Thank you so much for joining us on Keto Life Support. If you'd like more, you can join our friendly Facebook group, Keto Life Support. Can't find it? Go to ketolifesupport.com. If you ever want to suggest a topic for discussion, that would be the place to do it. We'd really, really appreciate it if you would go to your podcast app and subscribe, because that's awesome. And what would be super awesome is if you'd be so kind as to write a review for us. Though we would love it if that review was awesome, just writing a review is all we ask. So have a fabulous keto week, and we'll see you next time.